We are here at the Houston Hyperbaric Oxygen Center in Atascocita, Texas.
A family-oriented business born out of love.
We know of a family that had a son that had a brain injury, and they were wanting to do the treatment for him, and it's very hard to find other groups that will treat patients off-label, and so they actually purchased the chambers for them, and they treated their son for many years and got a lot of quality back for their son. And he ultimately passed away recently, and they asked us if we would like to take over the clinic because they knew that we would take it in the same direction and just help people who otherwise wouldn't have access to this type of care.
With this passion project, owners Dr. Allison Boyle and husband Brad Kopis have a big goal: to be the lowest cost facility in the state.
Unless you've worked in wound care, a lot of times you don't even know about hyperbarics.
Hyperbaric medicine has actually been around a long time, with the first treatments dating back to the 1930s.
So traditionally it was been used for pressure ulcers, so to get that oxygen concentrated to that area that needs it, can heal the skin and heal these wounds that can be debilitating and lifelong for some people.
As medicine evolves, doctors are too. Learning this type of oxygen therapy can be helpful in treating many other health conditions.
We don't know all of the ins and outs of medicine, and we learn as we go, and that's one of the ways that Hyperbaric is kind of rolling out as well. So we've had patients that come in for problems post-radiation. We have autistic children that come in. We have a lot of post-brain injury patients.
Even symptoms from long COVID.
I did 15 treatments. In the end, I think it was a good investment. I noticed probably from 10 to 20% lack of taste and smell. I probably went up to maybe 60 to 70%. It was very dramatic. Energy levels improved.
Houston Hyperbaric Oxygen Center also treats brain injuries, something Dr. Boyle knows all too well.
My mother actually had a stroke when I was a third-year medical student, and from that, it was quite an interesting experience to be on the patient side of it.
While her mom wasn't able to use the original hyperbaric chambers, Dr. Boyle set out to ensure other patients in her condition who are unable to lie flat could.
If we're talking about brain injury patients or autistic people or people who are just in general claustrophobic and don't want to be in there by themselves, we now have that ability to have somebody inside with them.
Patient Patrick Massey, who suffered a stroke, couldn't walk or talk when he first came in.
We were just hoping that the oxygen to my brain would help it, and we think it has. Yeah. It's very unusual to have this type of recovery from the type of injury I had.
During treatments, patients breathe 100% medical-grade oxygen while under increased pressure.
We have hospital-grade equipment, the same thing you find at your local hospitals here for hyperbarics. There's a big difference in chamber type depending on where you're going. The difference in chamber type is we're able to get to the appropriate pressures, and we have the appropriate protocols to treat patients depending on what we're treating.
The number and length of sessions vary depending on the diagnosis.
Our most common ones are 60-minute and 90 minutes, and those are the time at the pressure depth in the chamber.
Patients say they just lie down and relax while undergoing treatments.
The first few times I watched a movie, but after that, I just took a nap.
If you think you could benefit from hyperbaric oxygen treatment, check out Houston Hyperbaric Oxygen Center for a consultation.
We go through everything you can and cannot do with hyperbarics. We cover any contraindications, and we let you know what to expect.
It could change your life.
I'm just positive that there was a major positive impact for me.